Hello, I'm Dr. Pravallika, Ayurvedic doctor at Akkineni Hospitals. I hope you're doing well. Let's explore some important insights today. Please stay tuned and make notes.
Welcome to This Explainer. Today, we're diving into a seriously fascinating intersection of human knowledge. We're going to see how a 3,000-year-old medical framework, Ayurvedic diabetes management, actually holds up under the microscope of cutting-edge modern endocrinology. And honestly, the parallels we're about to uncover are absolutely striking. Here is our roadmap for today's explainer. First, ancient diagnostics, modern science. Second, evidence-based herbal pharmacy. Third, Ayurvedic dietary rhythms. Fourth, clinical therapies and detox. And finally, number 5, safe integrated medical care, where we'll definitely need to cover some crucial modern safety caveats. All right, kicking things off with Section 1, Ancient Diagnostics, Modern Science. So think about this for a second. How in the world did healers diagnose and truly understand a complex metabolic condition like diabetes 3 millennia before we had modern blood panels, continuous glucose monitors, or microscopes? Well, a classical text known as the Charaka Samhita actually described a whole spectrum of 20 urinary disorders, collectively called Prameha, thousands of years ago. There is one specific condition within that spectrum called Madhumeha. Literally translating to sweet urine, ancient practitioners pinpointed this through some incredibly sharp clinical observations. They noted polyuria, which is excessive urination, polydipsia, or excessive thirst, chronic fatigue, and sweet-smelling urine. These observations perfectly map out exactly what modern medicine now diagnoses as type 2 diabetes mellitus. It's kind of mind-blowing when you think about it. Let's actually act as a decoder ring here and translate these ancient Sanskrit concepts directly into our modern biochemical language. The Ayurvedic framework states that the fundamental pathology is an accumulation of kapha, which they describe as the biological water and earth principle. This accumulation impairs the medovāha strotas, or the fat-carrying channels in the body, which leads to a massive breakdown in metabolic transformation. Today, modern endocrinology describes this exact same physiological domino effect as visceral adiposity and insulin resistance impairing your glucose metabolism. So it's a completely different vocabulary, but the exact same physiological understanding. Moving right along to Section 2, Evidence-Based Herbal Pharmacy. Okay, let's really dive into this, because the modern biochemical validation here is just spectacular. Take bitter melon, or Karela. It contains an insulin-like compound called polypeptide P, along with charantin. Its modern mechanism, it actually activates AMPK, which, incredibly, is the exact same cellular target as the frontline pharmaceutical drug metformin. Then we have Gumar, famously known as the sugar destroyer. Its gymnemic acids temporarily suppress your sweet taste perception, but more importantly, studies suggest it may actually help regenerate pancreatic beta cells. And Vijayasar, which is traditionally used to make medicated drinking vessels, contains epicatechin. Multiple clinical trials show this significantly reduces fasting glucose and improves lipid profiles, all while supporting beta cell regeneration. These ancient botanicals are literally targeting the exact same pathways as modern drugs. But hey, it's not just exotic, specialized herbs. We're talking common pantry staples too. Fenugreek, or methi, contains a specific galactomannan fiber that slows down glucose absorption in the gut, while its unique amino acids actively stimulate insulin secretion. And cinnamon, or dalchini, it actually enhances your cellular insulin receptor sensitivity. Meta-analyses show both of these everyday spices possess specific, clinically proven impacts on reducing fasting blood glucose, particularly for patients who aren't yet on conventional medication. Now, I really want you to let this next number sink in. 100%. You almost never see 100% of anything in medical literature, right? But a landmark prevention trial regarding an Ayurvedic staple yielded this exact massive figure. Just listen to this finding. Curcumin supplementation prevented progression from prediabetes to type 2 diabetes in 100% of the treated group. Compare that to a 16% progression rate in the placebo group. Curcumin is the primary bioactive compound in turmeric, known in Ayurveda as haridra. It is so exceptionally powerful at reducing insulin resistance and lowering diabetic inflammation that in this specific study, it completely halted disease progression. Talk about a striking validation for integrating this root into your daily life. Which brings us nicely to Section 3, Ayurvedic dietary rhythms. Right at the heart of this is the concept of dinacharya. Basically, this is the Ayurvedic principle of having disciplined daily routines and metabolic rhythms. You see, Ayurveda insists that managing metabolic health isn't just about what you ingest, it is heavily reliant on when and how you live your day. Having a regular meal timing is absolutely critical because it supports your body's innate metabolic rhythm. So, what are the actual rules? Classical Ayurveda recommends favoring predominantly bitter, astringent, and light foods. Think leafy greens, bitter melon, and old barley. On the flip side, you really want to avoid heavy, oily, and high glycemic sweet foods like dairy, fried foods, and white rice. But going beyond just diet, the classical texts are incredibly clear on one major thing. Regular physical activity is described as the absolute most important intervention for managing this condition. Basically, exercise is non-negotiable. And here is a slightly surprising, highly specific lifestyle rule from the ancient texts that you might not expect. Daytime sleep is explicitly discouraged. According to the Ayurvedic framework, catching some Z's during the day after meals actually worsens that kapha accumulation we talked about earlier, and that directly translates to worsened glycemic control. It's a really fascinating behavioral habit that they strongly advised against. Let's transition over to Section 4. Clinical therapies and detox. When you move from at-home routines into an actual clinical setting, Ayurveda uses specific detoxification and metabolic therapies known as panchakarma. Let's quickly walk through 3 key stages they use for diabetes. First up is virachana, which is therapeutic purgation. Put into modern terms, this clears the gut-liver axis, which is totally vital for improving insulin sensitivity. Second is Udvartana. This is a vigorous dry powder massage designed specifically to reduce adipose tissue and balance kapha. And third is Vasti, or medicated enemas. I know, it sounds super ancient, but modern science tells us this actually directly targets and balances the gut microbiome, which we now know is deeply, deeply relevant to systemic metabolic balance. So these physical treatments are directly connected to systemic metabolic benefits. Finally, we reach Section 5, safe, integrated medical care. Now, we need to take a firm yes and approach here to make sure we're grounded in medical responsibility. The source material is crystal clear. Ayurvedic herbs and lifestyle interventions are powerful, highly effective adjuncts. However, they absolutely do not replace conventional anti-diabetic medications if you have established type 2 diabetes. We are talking strictly about adjunctive care here, designed to support and enhance your established endocrinological treatment. Because these natural treatments are so biologically potent, there is a very real, stark safety warning to keep in mind. There is a high risk of hypoglycemia, or dangerously low blood sugar, when Ayurvedic herbs are combined with modern medications like insulin or sulfonylureas. Think about it. If you activate AMPK with bitter melon while also taking a pharmaceutical that does the exact same thing, your blood sugar can drop way too low, way too fast. So careful blood glucose monitoring is absolutely mandatory. And this is exactly why integration is the future. Institutions like Akkineni Hospitals model this perfectly. They emphasize that all herbal interventions must be fully disclosed to your managing physician. Ideally, your care should be supervised jointly by both a conventional physician and an Ayurvedic doctor. That's how you ensure safety, prevent dangerous interactions, and perfectly coordinate modern pharmacological management with evidence-based Ayurvedic adjuncts, the whole shebang working together. So, as we wrap up this explainer, I want to leave you with a pretty exciting question to chew on. As modern clinical trials continue to validate 3,000-year-old wisdom, proving that ancient healers were somehow mapping the exact same metabolic pathways we study today, how will integrated medicine redefine our approach to chronic disease? I mean, the bridge between ancient observation and modern science isn't just fascinating, it might just be the ultimate key to comprehensive metabolic health. Thank you so much for exploring this incredible topic with me. Keep learning, stay curious, and I'll catch you in the next explainer.